This question deals with a 12-year-old girl who has been severely anemic. Her hemoglobin is 6 grams per deciliter for several months. Which of the following is most likely to be decreased during resting conditions? Now, let's do all of them. So I have all the options here. Let's do what's going to be the values for each one of them in an anemic patient. They just put in resting conditions just to throw you off. It just says in a normal patient, in an anemic patient in normal conditions, which of the following values is going to change? In this case, decrease. That's the one that we have to find out. So let's do all of them. So 2,3-DPG is probably going to be increased in an anemic patient because we need more efficient way of picking up oxygen and delivering to the tissues. So that's probably going to be increased. The partial pressure of oxygen in the artery is not going to change because that's the oxygen dissolved in the plasma. Having less RBC in the blood vessel is really not going to change that value. The cardiac output is probably going to be increased because we need more of the same RBC going through. It's like having less people doing the same amount of work if there were more people, right? So the cardiac output is going to be increased. What about mixed venous partial pressure of oxygen? That's the one. This is going to be decreased. Why? Because there is more extraction of oxygen at the end organs. So there is less oxygen going to the veins. So the mixed venous oxygen, partial pressure of oxygen is going to be decreased because more of this same oxygen is extracted by the organs because less oxygen is coming to them because of the anemia. Now what about, let's see what, if the hydrogen concentration in RBC is increased, then we know exactly what the answer is. Now hydrogen concentration in RBC is going to be increased in anemia. That's because there is more carbon dioxide present in an anemic patient. So when there is more carbon dioxide, what happens? Carbon dioxide is going to combine with water to form bidirectional equation forming H2CO3, and this is going to be carbonic acid. The H2CO3 is later H2CO3 can move back to carbon dioxide to give off carbon dioxide and to be released from the RBC. So what happens when there is too much carbon dioxide in the artery? The enzyme shifts to the right, and we have more carbonic acid. And when we have more carbonic acid, there is more of these protons present in our RBC. Okay. Now, since we're talking about it, let's extend our thought a little more. What happens when there is this is what happens when we have too much carbon dioxide. What happens when there is too much oxygen? Usually the hydrogen ion is bonded with the hemoglobin, but as soon as the oxygen comes and there is oxygenation of the hemoglobin, the proton kind of dissociates, and this proton is then released from the RBC, decreasing the amount of proton inside the RBC. Okay, so that's what happens when there is increased oxygen, but in this case we're talking about when there is decreased oxygen and increased carbon dioxide, making more carbonic acid, and which is increasing the amount of protons in the blood a little even more. So that's why it's going to be increased, because this patient is anemic and because there is a lot more carbon dioxide present in this patient. So there is only one option which says decreased value, which is the mixed venous partial pressure of oxygen. So in this case, D would be the correct answer.